Also, we have from Brazil, Vasco van Rosmalen. He's a political scientist with 20 years of experience in development methodologies with a focus on creating innovative tools and partnerships for development financing and implementation with a focus on private sector partnerships. Currently, Vasco is the executive director and founder of the Brazilian organization Equipe da Conservação da Amazônia, ECAM. Welcome, Vasco. We also welcome Daniela Gomez, political scientist, international consultant, researcher, and co-author of several books about the Colombian social and political situation. She is interested in the application of multi-scale, multi-agent analysis frameworks for the study of systems of prolonged armed conflict, organized crime, and corruption. Currently, she is coordinator of the Democracy and Governance area of the Colombian organization Fundación Paz y Reconciliación, PARES. Welcome, Daniela. And from Kenya, going on in Kenya with the COVID-19 situation.
Okay, so first of all, thank you very much for allowing me this opportunity, and I'd like to say hello to all the panelists with me today. Today, Kenya is dealing with still an increasing number of people who are testing positive. We have about 6,300 who've now tested positive, and we're talking about 145 people dead. We've been in a lockdown since March. Our curfew was dusk to dawn instead of at 7. Last month, it was pushed forward to 9 o'clock to 4 in the morning. We have seen an increase in loss of jobs for quite a number of people. We have seen how COVID has exposed the social inequalities that communities are facing in the different parts of the country. We have seen how the judiciary has scaled down the operation and now everything has gone virtual. An increase in sexual and gender-based violence cases that has gone up. And only just recently, as late as I think 2 weeks ago, we saw this massive number of teenage pregnancies because of the fact that we've had schools on lockdown since March when everybody was ordered to work from home. Different programs have been put in place by the government, and some of those have had massive impact, including the fact that we have also seen a shrinking of civil society space. Participation in a lot of county government activities, therefore, has gone down because of the social distancing rule that we have in place. Media is also becoming accessible, whereas we say that we've innovated and started to use IT, we also recognize how it has also become exclusive because of the inequalities that I talked about, where not everybody has access to electricity, to bandwidth, to water and sanitation programs as well.
Thank you very much, Betty. We will develop a little bit more these insights that you've been sharing in this first question. Let's go on with Daniela. Daniela, please share with us how is the situation in Colombia right now?
Well, first I want to thank Forum Syd for facilitating this talk and invite me to participate and say hi to my panel colleagues. Well, right now we have crisis that is in the last quarter. So the government has been conservative on the economic measures, and it is not open to implement a basic income that allows to maintain a strict lockdown. And for now, the picture seems to be getting worse, and we don't know any clear routes from the government to contain the situation, actually.
Yeah, thanks, Daniela. Let's move on to Tajiel. Tajiel, please let us know how are things going on in Tanzania.
Okay, thank you so much for the opportunity. First of all, the situation in Tanzania is different from many places in the world. With no lockdown here, and things are back to normal. I can say everything is running as usual, with the number of measures to contain the virus. But the way we responded is quite different because the schools and were closed, but now they are reopened. the data, which is not really available in the timely data that are not available. The last data we received were from April 2019, where we had the number of 509 cases and 21 deaths. So recently, from end of April to now, we have no data about the number of cases, number of deaths. So the way people interact, the way business going, it's like with no pandemic in Tanzania, you can say that. So people are so relaxed about the virus. They are so relaxed about the infection and everything. There are some precautions in public places, like any communication from the Ministry of Health, washing hands, using sanitizer, as well as wearing mask. But not everyone do that, because I can say the fear of coronavirus is very low in Tanzania.
Mm-hmm. And it doesn't feel like in the health system is being at risk right now?
Okay, for now it's hard to determine that, because we don't have data. Maybe whether for you to judge the system is collapsing or not. But if you visit the hospital, of course I have been around the hospital in the past week, but you can see the number of patients. You can see the flow of people, like unusual, So it's just quite normal.
Okay, thanks, Tajil.
Yeah.
Let's go on now to Brazil. Vasco, if you could share with us how is the situation in Brazil that we know is very particular.
Hi, everyone. Thank you, Carlos. Thank you so much for organizing this, and thank you, everybody, for being here. It's a pleasure to be here, and especially because this is such a South-South forum, which I think is truly important in the way that we are looking at the way that the pandemic is affecting the world. And it's really interesting to be able to have these differing insights into how different countries in the global South are affected or are being affected, especially because, as you know, the pandemic has a very different rhythm in each of the countries and regions where the impacts. So on one side, that creates a mixed picture, but on the other side, it gives us an opportunity to learn from those who are going through different phases of the pandemic, such as in Brazil, the pandemic started in big urban centers, Rio, São Paulo, but also in the Amazon, in the big urban centers of the Amazon and the Northeast, such as Manaus and Belém, which are cities that have 2 to 3 million people populations, and they were tremendously impacted in the first month of the pandemic. And in cases such as Amazonas and Manaus, you had numbers that are compared to small countries in terms of COVID cases. But as we see now in Manaus, the peak in the city has passed, at least for now. Just last Wednesday, we had the first 24 hours without any COVID deaths in Manaus, in the city. But what happened as these cities, urban areas were being hit, the virus started spreading out. In the case of Pará state, in the Brazilian Amazon, from Belém through the roads that transport soybeans that are used for extraction and for the transportation of goods coming out of that state. And so it's moved into smaller municipalities, smaller towns that have 50,000, 100,000 people, where you have also large operations, and there are important trading centers in the Amazon. What you had in Amazonas and Manaus is you had the expansion of the disease or the distribution of disease along the water highways. Amazonas doesn't have many roads, but it has many water highways. And so through these water highways, it went to the smaller municipalities. And what we see from there, what's happening today, which is really worrisome, is that it's moving out into the vulnerable populations that are in the rural areas. And that includes indigenous peoples. So in the case of, just in the case of Manaus, over 1,300 indigenous peoples are already confirmed with COVID. And the deaths are, as we know, are at a higher level in terms at least double in compared to other populations. At the same time, you also have the expansion of the pandemic in other traditional communities, such as the Quilombola, who are Maroons, descendants of West African slaves who set up their own communities, and that really gets to a point. What's one of our biggest worries is invisibility, as the urban centers like Manaus and Belém are starting to go past the curve. There have been a lot of reopenings in these cities, but the disease hasn't gone away, and its impact is continuing, especially in these areas which are much less visible, and into these communities which are much less visible, which are invisible in many ways. And the impacts go beyond health. One of the big worries right now in the rural areas is food security. Brazil has a very good social welfare network that was set up over the last 20 years. And that was used to be able to get emergency support to most families. So even though there weren't large amounts of funds, Brazil has been on a monthly basis distributing resources to families who are registered in these programs. But one of the things that came out as they were doing this is that over 40 million Brazilians weren't registered anywhere in any of these programs. And so how can they access? So we had, for example, a lot of support to communities in these rural regions where in order to sign up for a program like this, you need to have a cell phone with not only internet coverage, which sometimes you have, but also with cell phone coverage, because you need to be able to receive a text message. So those are the types of issues that we're facing in Brazil, that as the disease continues to spread into these rural areas and they are not visible to the outside world, the impacts are increasing, and specifically in terms of food security is one of the ones that we are most worried about.
Okay. As I've heard you say before, Brazil is a continent of different countries, so we can spend a whole webinar talking about Brazil, and it's a really complex country. I understand, and our viewers have to understand that especially your work and your organization deals with the northern part of the country, with the Amazonian region mainly. So yeah, we could extend to a lot of complex and different issues regarding the country. We will get to more issues related to what you were speaking right now later on the other questions. But now we give the word to Abdi from Somalia. So Abdi, please share with us, how is the situation in Somalia?
Thank you so much for having me. I think the situation in Somalia is more worse than many of the panelists have said, because as you know, Somalia is just coming out from the civil strife and mayhem of 1990s. Country apart from the COVID-19, we are struggling with the pandemic of locusts and floods due to the rains. And also the Somali health system is very fragile and very weak. Compounded with all that, the total confirmed cases currently today is 2,904. Total recoveries are 910, and total deaths are 90. However, we don't have an exact data on the exact number of cases in Somalia. Since many parts of Somalia is under the control of the extremists and is a no-go zone, also the government capacity is too weak to get data throughout the country. So that is how the situation is in Somalia. The COVID-19 pandemic has affected not only the livelihood of the Somalis, but also due to the political anticipated election of 2021. You know that 80% of Somali livelihood depends on either remittance and casual labor, of which both are very well, majorly affected by the COVID-19. Remittance from the outside world, because of the lockdown from other countries, is now having a very big toll on the food security of every household. Secondly, unemployment, because the restriction of movements lockdown by air, by land. The supply chain of the basic food items is already not there. So that is the effect economically. Politically, Somalia is anticipated to have an election in 2021. However, because of this lockdown, a lot of legislation, like the finalization of the election law, the draft constitution, the 30% woman quota, many of those legislative issues are still burning because of this petition of non-assembly, and therefore that is the situation in Somalia. Thank you so much.
Thank you, Tajel. And yeah, you bring up something that we can see that in general in our countries, we have this tension between the economical impacts of the virus, but also the health impact and the impact of the health systems, how they are not prepared in general in our countries. Maybe I can consider that Brazil has, at least in some regions and in some cities, a different situation there. But then this is related to our next question, and we can start with Betty here to talk a little bit about Kenya, and this implies about the measures the governments are implementing facing the COVID-19 crisis. And here I want also for you to share like the different levels of government, if there are some kind of tensions between local and national governments, or is there some good coordination and a synchronized way of dealing and handling the situation in policies and in different kind of measures?
All right, so there's been a number of activities that have taken place, and right from the beginning, I have to say that a lot of this have actually been spearheaded by the national government. So for the benefit of others, Kenya has got 47 independent yet connected counties, and every single county has got its own allocations and has its own leadership elected by the citizens every 5 years. And so in response to the COVID pandemic, a number of all these counties actually decided, most of them went and decided to review their budgets so that they could find out how they would allocate money to respond to strengthening the health infrastructure in preparation. Because at the beginning, when this came out, it was that it was going to be either you fix it, you will die, and that having an effective health system was necessary to be able to address the impact of COVID. So a number of those countries went and reviewed their budgets to be able to put in place some resources that would be able to address a lot of the weaknesses that, of course, were exposed immediately this came into place. But the country has also done quite a number of things. In a bid to stop transmission, of course, we've seen quarantine set up, working from home, the wearing masks, sanitation and hygiene, programs have been put in place. And this have been taken right across the whole country. And in provision of care for those infected, we've seen isolation centers, treatment care centers established. Part of the argument that was given for the lockdown was that as we were strengthening our systems and ensuring that we were prepared for handling the impact, there was therefore the need to be able to shut it down so that it gave counties an opportunity to be able to put in place a system. Last month, as the government was reviewing whether to open the lockdown or not, one of the reasons they gave for the extension was that counties had not been sufficiently prepared in terms of their health systems to handle the impact, and therefore we got another extension. The national government has been able to allocate money to county governments to be able to see how they can also improve. But it must be said that because of the emergency laws in place, it has been very difficult for us to be able to monitor and track and even understand how much money has been put and where that money has gone to. So generally what you get is that we are responding to the impact by ensuring that we have systems in place. The other thing also that the government did was that it closed down its borders. airport borders and the borders that we have. So coming in has become very difficult, but also the other East African countries have also closed their borders. So that is something that we're able to see. So Kenya, like most of the other countries, applied a sort of mirror response to what we were seeing in the Western world. But then, of course, closing of the borders has its own impact for people who engage in business across. But the idea was that you stop the spread, because that has been the general justification for that. But there are also other things that they put in that really have been good. There is a pilot program to be able to address the economic challenges that people have. So we do have money transfer programs that is given to vulnerable groups, women, widows, persons with disability. And of course, there are questions being asked about the identification process and how it's been done. The government has also put in place certain job programs for people in the informal settlement, where they work on a cycle of about 3 weeks, and then you've got a new lot that comes in. And the idea is to make sure that you have as many more people that are able to have a few, money in their pockets. And this is to address, the fact that we are seeing more than 50% of the population in Kenya who have lost their jobs. And then, of course, finally, we also have got the immediate response that was affected right when the government started, and we got to see police brutality, and in the first couple of weeks, we were talking about people who were being beaten, people who were being taken into quarantine centers, and as a form of punishment, they were then, they had to pay to be able to be in those quarantine centers. Their only reason for being there was because they had broken the law. So, and in the process of all this police brutality, Kenya was able to record at least more than 20 people who died as a result of the police response. There has been changes in terms of the fact that the violence has gone down, but it has not been completely eliminated. Whereas we started with our curfew at 5 o'clock to from 7 o'clock until 5, we now have a curfew that is on from 9 o'clock until 4. But we've also seen that they have reduced the movement across counties. So there are certain counties that are on complete, total lockdown. And the reason being was that they wanted to see how they could contain the COVID response and management and not allow for the spread to other areas.
Okay, thank you, Betty. I want you to keep that idea later, because we will be talking a little bit also about specifically human rights and the impact on different kind of freedoms, also of mobilization of speech. So we will have the chance to extend a little bit on that you're talking about. So keep that there. Let's go back to Guatemala. Let's go to Wendy to see how has the Guatemalan government implemented some measures on this situation.
Since March, a state declaration of public calamity was approved here in Guatemala, which limits constitutional rights and facilitates state purchases. So closure of borders by air, sea, land, only commercial transit is allowed. Total closure of schools and universities for more than 3 months now, shopping, recreation center, no public transport in all the country, suspension of all social, cultural, sporting, religious, political events. Interstate transit of people is banned too for the most affected states, which are 5. And the curfew is from 6 p.m. to 5 a.m. every day nationally. And on Sundays, no one can leave the house nationally. On March 25th, the government approved the emergency law to protect Guatemalans from the coronavirus pandemic, which allocate funds to cover programs for health, employment, security, the economy, and the elderly. It also ordered health authorities to provide funds for hospitals and health centers, and to spread information on the pandemic in the Mayan languages all around the country. However, until a few days ago, this budget continued without being executed, and medical personnel working for the hospitals have recently complained about poor working conditions, and some doctors, nurses have died. The government economic support programs have included distributing food, cash bonds for job loss, loans to small and medium-sized enterprises, and there is a mandatory use of masks out of the house, and the social distance is mandatory, and the curfew and the stay-at-home orders are enforced by arrest. These are some of the measures that we have here in Guatemala. Thank you.
Thank you, Wendy. Let's move to Tajiel. Let's go back to Tanzania.
Yes.
How is the Tanzanian government dealt with the situation, Tajiel?
So the way we responded, the way the government of Tanzania responded to this pandemic, as I said earlier, is quite different. We saw the COVID-19 as a matter of economic issue when you compared it to health issues. So for that basis, with no lockdown, with no any other restriction in terms of internal movement and mobility, so that kind of things. So we had a number of government initiated a number of response, including closure of schools and universities and colleges, and public awareness about the health, hygiene, sanitation, use of sanitizer, mask, and other things. But the political movement or the political move was more of promoting homegrown solutions, actually, including thermotherapy. This is a steam therapy. It's one of the local or a traditional method that have been used for years along the generations to control flu since our childhood and our grandparents. But also the other method or initiative as a response was more of using faith-based approach, trying to bring hope to people that we can pray actually against this COVID-19, and through that, I'm sure we are going to to go through this. So I saw it as a way of giving hope to people that yes, we are in this crisis, and the government admitted that we are in crisis and coronavirus is there and it's killing, but insisted much of having hope that if we pray, if we do steam therapy, if we drink lemon and ginger tea, actually we're going to boost our immunity. And at the time there was a mass use of vitamin C. It was even, you can go even to pharmacies and find it's sold out because people were using products that can emulate their immunity to be able to fight the virus. But also we had other, of course, our border were closed, airspace, land was not really closed. We were all open. We were doing a business with our neighbors, including Kenya. But there is a number of issues when it happened to that. The issue of having data people when they travel to other countries, if they're infected or not. But that was solved bilaterally by having a high-level meeting with the respective countries. So what happened, it made everyone in Tanzania to see this COVID-19 as a matter of himself or herself with the virus. So the level of awareness, the level of being ready to fight against the virus was more of on individuals know that I'm responsible for my health. I have to take precautions. I remember at one time during the early days, the regional commissioner of Dar es Salaam city, where I reside, and it's a commercial city of around 7 million people, asked the mass that you go and meet your sit with your family and agree and make a kind of precaution as a family, put in place some principles that you and your family, what are you going to do against the coronavirus? How are you going to protect yourself? Because we can't lock down the country for the economic reasons. We can't lock down the city, which is Dar es Salaam, the largest city in Tanzania, because of coronavirus. Things need to go, business need to continue, and life will be there. So, and one of the argument actually, which was, I can say was more visionary, the argument would say that the coronavirus will be there just like other diseases like HIV. So we should learn how we're going to live with it. Because if we do lockdown and this COVID-19 didn't disappear, how are we going to rebuild our economy? How are we going to rebuild our family after that long period of time? Saying so, we've seen the impact actually, despite of this hope and other things. There are confirmed impact, I mean, in terms of lives of people, and other unconfirmed. So you can't judge whether this death was caused by coronavirus or not. But those who announced the 21 deaths were announced by the ministry from 29 April. That was end of April. Since then, we have no updated figure on the case of coronavirus. But
yeah, it's an impact, really.
Yes, exactly. So the way it is, it's more for, it was the Ministry of Health was leading the campaign, making sure that the mass and the institution and private sector actually supported a lot of these initiatives, making sure that the public have a facility to wash their hands, they have facility to use sanitizer and those kind of things in the market, in the grocery, and that kind of thing, because everything was running as normal.
Okay.
Yeah.
Thank you, Tajel. I think now we will have a contrast as we bring Daniela to share with us how the Colombian government and the local governments within Colombia have been implementing measures related to what Tajel just shared with us. So Daniela, please.
Well, first of all, we have to say we have 3 levels of government in Colombia: national government, department or state governments, and municipalities. But state government has not like that power as municipalities have. So the main tensions between authorities have been between municipalities and national governments. From March 6, when we have the first case reported in Colombia, the national government has introduced more than 120 laws. So it is very difficult to civil society, even for Congress and judicial branch, make control of them. The main response to the pandemic was, as in the rest of the world, the lockdown. This measure include closing schools, malls, churches, stadiums, and all places where crowds could appear. Also, the government implement protocols for virtual work and homeschooling. Beside the lockdown and the complementary measures, there are few that are really visible to the public opinion and civil society in general. It has been approved a rent of $50 per month during 3 months for almost 6 million people. But actually, we have 12 million people on their poverty line, and our minimum salary range is around $250. So it is like not sufficient to cover the lockdown or maintain the lockdown. Also, the government has approved credits for entrepreneurs that, as our organization and the media reveal, has benefited the large ones and have had a little effect on unemployment that, as I said before, is increasing during the pandemic. Few reforms have been made in the health sector. The government has limited itself to purchasing ventilators and COVID-19 tests. And the context of high international demand that has prevented the expected increase in hospital and diagnostic capacity, actually. As I mentioned, the government has been relaxing the lockdown since June, and now we are preparing to open all commercial activities again, and it's expected that in August, schools are open again too. So some local authorities are in opposition to this, especially Claudia Lopez, mayor of Bogota, our capital, and that warned the government that if the city reach the 70% capacity of the intensive care units, she will introduce a lockdown by herself. Until now, the local authorities have been centered on provide food and shelter to the poor people and to coordinate with the national government the implementation of their measures. Some of them also are introducing measures to deal with secondary or other secondary effects of the pandemic, as domestic violence, for example. But actually, they have to limit budget to deal with the pandemic. So there are many municipalities that cannot access to ventilators by themselves or COVID-19 tests. So the management of the crisis is very centralized by the national government. And it is very worrying for us that it is too little control from the other branches of power, of the government measures, actually.
Yeah, thank you, Daniela. Let's go back to East Africa with Abdinur. Abdinur, please, how the Somalian government has dealt with the COVID-19.
Thank you. Since March, when the first case of COVID-19 was reported in Somalia, the authorities have established a COVID-19 response coordination committee led by the Prime Minister, in conjunction with the WHO and the UN agencies. Simultaneously, the Ministry of Health has launched a country preparedness and response plan to address the COVID-19 pandemic. Due to that, the government have opened some COVID-19 centers, one in the capital city and one in each regional state capital town. Also, the government, through the Ministry of Health, has dispatched medical supplies to many of the regions in south-central Somalia to combat this COVID-19. As you know, Somalia have got two layers of structures. You have got the federal government of Somalia, and then you have got the member states, of which for the last 2-3 years, both center of power are not in good books due to power sharing in ideas, due to resource sharing, and due to the election, anticipated election. So this has become a challenge to having putting all the energy to combat the COVID-19 response. Also, the government since March have given more than 57 directives on COVID-19 response. That is really related to social distancing, closure of academic institutions, and restriction of population movements. 6 were imposed on suspension of international and domestic passenger flights and restriction of land transportation. 9 related to border closure, 6 related to night curfew and other personal restrictions. 1 positive, 1 directed tax exemption of the 2 basic food items of rice and wheat flour. Tax exemption was given for a period of 3 months. 2 related to education and 2 related to the registration of viral activities and deceased persons. However, as I have earlier said, the weak and fragile health system cannot cope with the pandemic in Somalia. most of these directives are only rhetorics. In Somalia now, most of the hotels are open, religious sites are open, most of the Quranic schools are open. There's no social distancing, people move freely. In the major market in Bakaro, you will really wonder whether you are in the COVID-19 or you are in a public holiday. So, because of the complex socio-political context of Somalia, many people do not live in most of these restrictions. To them, basic food and basic life is more important than anything else. So this comes to a time when the government do not have that capacity to impose most of these restrictions, both politically, socially, and economically. So that is the state we are in Somalia.
Thank you, Abdinur. Vasco, please share with us how has been the situation in Brazil with the measures implemented by the government and mainly by the regional governments of the states that your organization ECAM works with.
So the situation in Brazil is very similar to Colombia. You've got the federal, state, and municipal governments, and in the very beginning of the pandemic, all levels responded well. Then it became very clear that the federal government wasn't going to take on its role in terms of orientation through what the current administration's position on the pandemic, which is called the little flu. And so a lot of the pressure went immediately to the municipalities and to the state governments, where most of the actions taken in terms of lockdowns, quarantines, and also, for example, the prohibition of transport between states and between municipalities fell to these levels of government. So in places where we work, that initially was very effective. So you had municipalities that implemented a total lockdown from outside, preventing people to come in from the outside, and we were able to keep infections down initially. But as pressures from the federal government and from certain economic sectors increased, we've seen that Brazil has gone into reopening. And it's reopening on the wrong side of the curve, as Brazil is still increasing very much in terms of number of cases. And this has happened everywhere in the north, south, and central Brazil. Where now you have a continued tendency for the reopenings. And in Brazil, in October, we'll have municipal elections. So the mayors are also very responsive to that. There's currently a proposal in place to delay that until November. But still, there's a lot of pressure from the economic sectors to reopen. And as I said, on the wrong side of the curve. At the same time, old habits came back, and so there are currently, for example, 3 governors from the states that have been most badly hit currently under investigation for corruption in the purchases of respirators and others. So even though Brazil has, as Carlos said, Brazil is a continental country. In many cases, in many places, it has good infrastructure that should be able to deal with this. In other places, such as the Brazilian Northeast and in rural areas, or even you don't need to go that far. If you go to the periphery of Rio de Janeiro, São Paulo, or the big cities, the level of infrastructure there is comparable in many cases to regions that we wouldn't understand as Brazil in terms of what the image of Brazil has. And even here in Brasilia, for example, where I live, where you have a relatively good infrastructure in the center of town, you have a lot of what's called satellite cities. So you have 300,000 people in the center, but 3 million people who live in different bordering states that all depend on this center. And right now, for example, in Brasilia, over 90% of the private sector beds are occupied. We're over 90%. And even in the public sector, we're talking about an overload already of the system, when we're not even close to hitting what we consider the peak of the epidemic. And what you see there, just to go already into the next question, is where as the municipalities initially responded and the states initially responded and now retreating, a lot of it is now being held by the civil society groups. And Brazil has a very strong civil society organization and groups. And those they have been working together, whether, for example, APIB for indigenous peoples, CONAC for Quilombola, or the CUFA, which is responsible for the favelas region or groups. They have been forming alliances, whether it's with companies, municipal governments, but also mostly with judicial sectors, to form committees, either whether it's a transportation committee, a COVID committee, where they're working together to get most needed aid to those most vulnerable in their communities, and also to start looking at how to deal with the economic impacts. Because the way that it's being put is the economic impacts will be mitigated if we reopen is not the truth. It's not the way I think they're going to happen. Even if you reopen, the economic impacts are tremendous. That's what's said before, is that you have these close downs, communities are isolated from their markets. They can't take their products to markets. They can't interact economically. And that's going to continue whether or not the government has a mandated lockdown or not. And so those impacts are the ones that are really important. And Brazil is going to have to count on its civil society groups to do most of that work.
Yeah, I agree with that. And of course, we will have a moment to talk about where is these new roles for civil society, not only now what is going on right now, but what we see that will be this new normality that we will have as soon as things go more stable, as soon as we have a vaccine. But then it will be nonetheless a new normality. We will not definitely go back to what we were before. And what is the new place for civil society there, or the new places there? Okay, let's move on to our next question, and this one relates specifically to the situation for human rights. How have human rights been affected in our different countries by the response to the pandemic? I am in Colombia, so I can see some things that can be similar in some way to what is going on in Somalia, maybe on how some illegal armed actors can have some kind of situation specifically. But I want to invite Daniela, that she, of course, will be a better voice and perception. She will have a better perception of the situation here in Colombia. So, Daniela, how has human rights situation been affected by the response to the pandemic here in Colombia?
Well, we have many views from the situation, actually, because sorry, give me 1 second. I closed this. No,
it's okay.
So sorry. There have been different human rights affected because of the response to the pandemic. First of all, as in the rest of the world, it appears to be a criminalization of the poverty, right? Since the economic measures of the national government and local governments too came 2 and 3 weeks later after the lockdown, there were many people, especially working on the informal sector, who had to violate it to get food and pay for shelter. And the police response to these people was, in many occasions, violent, as in Kenya, our colleague said before. In this way, the pandemic in Colombia reinforces the prevailing exclusion and inequality between groups of people and different regions in our country. Actually, the most remote regions of our country, such as the Amazon region, are those who have 100% occupation of the intensive care units. In Bogota, the hospitals in the south of the city, where they are mostly inhabited by people with limited resources, are also at their peak, while the hospitals in the north, where the wealthy people of the city live, are mostly with low occupation levels. As worldwide, women are the most affected population by the pandemic too. 4 out of 10 households in our country are run by single mothers. Many of them are informal workers and are under poverty line. So the lockdown added to the suspension of their children's schools period has made it difficult for them to access basic goods and services. On the other hand, domestic abuse has risen since the lockdown, and now many of the victims have been forced to stay at home with the perpetrators. And there are not many measures to respond to this. And since the lockdown, also more than 10 former combatants from FARC and 38 human rights defenders have been assassinated. And according to the United Nations. And in some regions with armed conflict and organized crime prevail, the lockdown measures have been implemented actually by the armed groups and criminal groups. There has been people assassinated for violate the rules, and other communities are confined with no possibilities to escape their control. And they have had problems with the supply of basic goods because of the confinement. And many of these communities are also being attacked by the military forces during the lockdown, given that the government has introduced once again, it was suspended, the forced eradication of coca crops in which this community works. So like the human rights situation is very difficult right now in Colombia. And the control of the criminal groups and armed conflict groups are actually getting worse. And this is like the worst situation is living in the frontiers of the country.
Yeah, we will get back to that later. We can talk a little bit more about that situation with migrants and refugees here in Colombia, but also in other countries that have the same situation. Thank you, Daniela. I want to move now to Tajiel to know a little bit of how in Tanzania, despite that coronavirus seems to be not a big deal for you there, how has the human rights situation been affected in some way by the response and by the COVID-19 crisis there?
With our response at the government, the incidents of human rights violation are not really reported widely. So it's basically it's a discussion on social media and other platforms where most of talks were more of gender-based violence at home. So during the closure of school and this pandemic, so we don't have like a state machinery violation of human rights in relation to response to COVID-19. I can say one of the things that happened during the COVID-19, I can say, is the issue of teenage pregnancies in many places, particularly the southern part of Tanzania. And these teenagers, they can't go back to school to resume their formal education. Let's say they were in secondary education, they can go back to school because of the policy that we have right here. So that's one of the things which deals directly to you violation of human rights, because the students, they won't have a right to education, particularly the desired one. They may go to another system or other form of education, but they can't resume their studies because of teenage pregnancy. That's what I can say for now.
Thank you, Tajiel. Wendy, how has been the situation with human rights in Guatemala on this context of the
keep in mind that here in Guatemala, 60% of the population have living conditions of poverty and inequality. So we have an economic system based on land grabbing by extractive enterprises and agribusiness, and there has been an expulsion of youth peasant that migrates to the United States to sustain poor families through remittances. And given the economic crisis in the United States, the undocumented Guatemalans are among the most vulnerable to the economic impact of the COVID-19 crisis in the USA, where they work as day laborers and don't have access to benefits at all. So it is logical that remittances are dropping and is affecting our economy badly. And in the other hand, millions of Guatemalans work in the informal sector. More than 50% make less than $3 per day, with no savings and already very high rates of chronic malnutrition. So not being able to leave home to work is already devastating to the majority of the population. And the police enforce curfews and the closing of borders, no public transportation at all, a school and non-essential business. So the informal sector that sustain the majority of the population, all of these are provoking reports of food crisis. Also, there is a high level of racism and discrimination here in Guatemala for centuries against indigenous people, which represent 50% of the Guatemalans. And there has been lack of access and quality of education for them. And during this crisis, particularly, for example, these children, indigenous children, Mayan children living in the rural areas are not studying at all. They don't have access to computer, internet, and so they haven't been studying at all. And it's different from the children from Guatemala City and urban areas. So also something that also has happened is that during confinement at home, domestic violence reports have risen. But the strict enforcement of curfew and measures means that defenders also are unable to respond to these domestic violence issues. And human rights defenders under threat are unable to move to feel more vulnerable to attack, and some are reporting an increase of harassment. So there is also a loss of legitimacy of the authorities for corruption, human rights violations, cooptation of the state by business and criminal interest. Although there is a new government starting in January this year, the situation are still present. So if the human rights had been really bad here in Guatemala for centuries, now with this crisis is worse.
Yeah, definitely. And I also think, as you stated, that corruption issues were already critical in the region and in many of our countries, but now with this crisis, it has exacerbated like those practices and made the situation probably worse, and the response not as good as we have wanted to be. Thank you, Wendy. Let's move on to Abdinur to see how in Somalia have human rights been affected by the response to the pandemic.
Thank you. I think that the situation of human rights in Somalia during this COVID-19 pandemic has been very worse. There was more than 4 deaths reported, which culminated the suspension of the night curfew. There were arbitrary arrests, there were restriction of movements and gathering, and many of those affected population were the marginalized groups. Like the capital city hosts more than 250,000 IDPs and returnees. The brunt of this human rights violation were those groups. Cases of GBV cases were reported. Issues of domestic violence, attempted rape, child exploitation. However, as I've earlier said, access is very important in Somalia. Many of these areas are very inaccessible, where inaccessible by the organization or civic society. The issue is about insecurity and the fear factor. You know, guys, in Somalia, everything is based on clan dynamics. That's why we have the 4.5 political system. And so most of the victims even do not report. So that means it lowers the number of reported cases. Also, there's the issue of the cultural and connotation over some of these GBV issues. Issues like a rape is sometimes a cultural taboo in many of the Somali communities. The victims, instead of coming forward and reporting, may not do that because of that taboo, one, or the fear factor, because it's probably a marginalized group or from a minority clan, and if she make a point about the culprit, tomorrow not only herself but her family may be at a loss. So the security situation of Somalia has been worse, but COVID-19 has been more worsening because of these other additional restrictions. Many of the security apparatus have taken everything to their law, the law into their own hands. There were a lot of detention reported on individuals on flimsy issues like breaking curfew law, breaking most institution of movement and the rest. So it is a grim picture in Somalia. Thank you so much.
Thank you, Abdi. Let's move to Vasco. How is the human rights situation in Brazil right now with the pandemic response?
So in Brazil, it's worrisome. Just for example, in Rio de Janeiro, since January, 750 people have been killed by the police in the first 5 months. There's been an increase in police killings in Rio and São Paulo. Close to Ministry of Health now is run by a general as interim minister, and most of the key posts are occupied by military officers. The same, for example, in the Amazon in terms of the campaigns against deforestation. While civilian oversight agencies such as IBAMA and others have had their budgets reduced and their ability to act reduced, it's the military that has taken on the campaigns against deforestation, with mixed results at the very least. So as Brazil continues to, what you can see is that these are trends that have been happening already, such as the increased killings by police in Brazil. Last year already was a record year, but the pandemic has certainly made it worse. And added to that is attempts to, for example, control the media. For a while, the Ministry of Health tried to, as a very clear example, tried to obscure the information around the COVID cases, how many COVID cases there were in Brazil. And again, civil society and media organizations responded and started reporting the numbers on their own. And the same is the case in other places, that as we have an increase of military tactics in Brazil. And Brazil is a strong democracy. It has very strong institutions. It has very strong judicial institutions as well. But there is this very worrisome trend to an increased military presence in issues and in agencies that should be under civilian control. And the same is the case, for example, for rights defenders. Brazil over the last couple of years has had a tremendous increase in violence against rights defenders. Very little of that is known. We work a lot, as I said, with the Maroons and Quilombolas, and it's the level of threats to these communities has definitely increased, and also official institutional processes to exclude them, to continue to make them invisible, The reduction of land rights for indigenous and rural communities in Brazil has been extensive, with new legislation, or at least new federal decrees, which allow for the occupation of indigenous territories by land grabbers, much as was said in Guatemala. Is that Brazil is facing all of these attacks on every front, but we very much count on the strong institutions and the strong civil society in Brazil to control it, to reduce it. And we've seen responses by the Brazilian Supreme Court. We've seen responses by the Brazilian prosecutors in many of these cases on the side of the judiciary to reduce these trends, or to at least try to resist it, and the same on the part of civil society. But Brazil is definitely going through a process of reduction in rights at this point.
Yeah, I think from this side of the world, I think it's a general situation. Betty, how is the situation for human rights in Kenya right now?
I think it's been similar to what we've seen in other places in South America as well. We have seen a great police response to a health issue. And so the culture of police brutality that Kenyans have had to deal with is something that they've been exposed to in this short period of time, and it has been brutal. But I think just the fact that our political leadership has been quiet about it has perhaps been seen as a tacit acknowledgement and approval of the action that the police have taken. Yes, there are some police officers that have been held to account, people have been able to report, but we still continue to see incidences of police violence, and the level of impunity that one experiences when they're being recorded, they're able to say there's nothing that's going to happen to us. The other thing also has been, the right to healthcare. Now, one of the things that COVID has done is that it has been stigmatized. And so community members are refusing to go to hospital because some of them thought that if they did go to hospital, they would be told that they had COVID, or they tested positive for corona, and then they would be quarantined. At the beginning of this response, when people who were breaking the law were found, they were taken into quarantine as a punishment, not because they tested positive, but as a punishment. And on top of that, there was a financial implication to that. So most of the citizens assumed now that if they do go to hospital and somehow their temperatures are high, they would be then transferred into an isolation center or quarantine center, and they'll be made to pay. So we've seen less people going to hospital. But there's also the aspect around strikes that has been there because of lack of payment for doctors, and how curfew has also affected people's right to access healthcare. And we have seen that perhaps, for a number of women within the community in the rural areas, they're now going back to the midwives at the community level to be able to help them with, maternal response. The other thing also has been, access to information. So yes, we decided to go and adopt this new virtual reality and platforms that everybody's using. But then alongside that, we made very many assumptions, that everybody could access it, that people had the resources. But we've seen how it's also created a sort of exclusivity. So for persons with disability, there has also been a complaint that we're not able to access any information because A, it is not in a language we can hear, B, we simply cannot see. So visually, challenged and hearing impaired continue to say the information that is being presented is not in braille form, and it's not done in a way in which we're able to access it. Now, the social distancing means that you're not able to get anybody in groups, but we don't seem to have become creative enough to see how we can actually encourage participation, particularly of persons with disability. Then we're seeing, the absence of public engagement in the development of policies that is in place. So we just get a policy and we're told this is the law. The emergency response has required that, everything is done, from a caveat. And for us, we are seeing slowly a creeping in of a form of authoritarian rule where we pass the laws and you're supposed to be able to engage in it. So at the county levels where we're having the 47 counties, we've also seen the public are not engaged in how their budgets are being developed, neither do they have information about how the money that is being allocated is going to be spent. And because it is not demand driven, it means they really do not have a say in terms of how that development is going to affect them, especially now when we're looking at post-COVID response and how that post-COVID response is actually going to be dealing with the realities that they're going to be facing in the future. Then, the fact that the judiciary has scaled down, it means that people who have cases are not able to self-represent. because everything is on a virtual platform. You want to file in an application, you've got to go to a virtual platform. We've actually had cases that are dealing with children that are not being dealt with because the children's court is not working. We have SGBV cases where we're told you must go and report to the police station, and the police station have been told you must make sure that you do not have a lot of people because we're social distancing. In fact, right at the beginning of this pandemic, Kenya was able to actually release close to 5,000 offenders. And so they're saying we're not going to take anybody in and keep them in the police station, and neither are we going to congest our courts. But when you're dealing with issues around sexual and gender-based violence, and you do present yourself in a police station, and you go there with a perpetrator, they are finding themselves being given bail, which means that once they go, the chances of them ever being arrested becomes a challenge. And for this particular person, access to justice is therefore affected. And so, particularly where we're looking at issues around sexual and gender-based violence, the absence of justice for them means that we continue to create an impunity narrative, because then it means people know that they're able to get away with it. Then you're looking at education. So one of the things that we also did was we decided to take our education online, but we made many assumptions. One, we assumed that, people have got electricity, people probably have houses with numerous rooms, that they family have capacity to be able to buy bandwidth, or that you actually have parents who are staying at home. And so we've seen so many children who are not able to follow the education curriculum, despite the fact that the government is saying that they are going to organize for exams. So you have people who have been completely unprepared against people who have got the means or have been able to continue with their education online, but all sitting the same examination and expecting that they're going to be able to say that the outcome is going to be fair. So it has triggered massive violations that we have seen, but we can also be able to say that we've been able to see a response from civil society. The human rights defenders who have also had their lives threatened or they're intimidated just because they continue to monitor. The shrinking of civil society space means that even as you want to engage in some of these issues, the absence of information, the fact that you're social distancing means that you cannot be, you're not as productive and as useful as we actually were. And we are finding it very, very difficult to be able to engage with our political leaders because they've been completely detached. And whereas, the country had a very thriving opposition, we've seen that completely going down. And we're seeing an authoritarian rule that's slowly creeping in, where now we seem to just have one government, speaking the same language, all in tune and in line with everything. So for Kenyans, the absence of that leadership that can actually speak on their behalf is something that we're taking great concern about.
Yeah, thank you, Betty. Yeah, I think that despite the position of the governments, if they're authoritarian or if they're less authoritarian or more democratic, or if we're prioritizing the economy or not, sacrificing it in some way, still this situation, probably a general impact, has been like increasing the gaps between social conditions for people, despite all those specific context situations on the specific governments and the specific measures taken. So that's something that can be, I can still see a little bit of from what you are all sharing now. I will jump now to probably our last question, as we're running out of time, so we can have a little bit of time at the end to share some of the questions that our viewers are sharing with us. First, we will bring a last question regarding civil society. And this is, in your context, how have you seen, and mainly your own organizations and your own network of organizations that you're part of, how have civil society been responding to this situation, specifically with human rights and humanitarian conditions in this context? And also adding to that, what more can we do as a civil society to enhance effectiveness and reduce these negative impacts that the situation has brought up? So it's like two questions in one. How has been your response, and what else can you see that can be done in the future, in the near future, to enhance this work that we're doing? I will start this with Wendy, probably. We can go with Wendy from Guatemala.
Okay, I work for ActionAid Guatemala, and in our case, we have been supporting radio campaigns, mainly in local indigenous languages, to share all the guidelines to prevent and to stop the spread of transmission. We have disseminated messages through radio, mobile speakers, social media, to increase all this awareness and target especially remote rural communities. We also have, it's important for us, the food security is very important, not only to distribute food packages, but also seeds to plan and to make sure they will have a harvest in the future. And also for us, we have been together with other civil society organizations, and we have tried to be organized and to exchange the community organization. It's really important that all the base local organizations are exchanged. So we have tried to support them, because it's important, the self-management for them. Also, all the respect, to maintain vigilance on respect for human rights. It's important to guarantee these human rights defenders here in Guatemala, to strengthen civil society alliance also. I think we need to be together to try to solve this crisis that is affecting all.
Thank you, Wendy. Let's move on then to Betty from Kenya. How is your organization and the network of organizations you are part of in Kenya dealing with the situation, and what else can you think can be done?
So there's been a number of things, I'll talk about what we do as an organization, but generally also what the civil society response has been in Kenya. For most of all the organizations, there has been a need to adapt to the current situation and be able to change, and it's been based on the sort of program that you're doing. And for me, I've seen massive creativity going on in terms of how we have used the social media platform to be able to engage and to be able to rally around and to be able to talk about issues. I've also seen, for us also and everybody else, there has been a very strong move towards networking and collaboration, and it's been thematic based. So that's really important, because then it means people who are doing the same things are coming together and then using their energies to ensure that there is more efficiency in terms of how they are working. I have also been able to see civil society members committed to demanding for accountability, and there are police officers who've actually been charged with focusing violence, or be charged with the violence that they've caused on citizens. So that's really a plus, because then it means that despite everything else, we still do have an institution that's actually working, and that is the judiciary, for which we must be able to report. I've seen an improvement in data collection and evidence gathering from human rights-based organizations, human rights defenders, community members. There's been a rallying around, because we've created platforms where people are sharing, and the sharing has seen a lot more people committing to demanding for accountability. We have also seen that there are petitions that are being written by civil society based on the actions and reactions that we're seeing when it comes to implementation of the containment and movement laws that have been put in place. And a number of those petitions have come up with massive recommendations that we have seen adopted by the judiciary. Some of it has also been adopted by the Ministry of Health, particularly the one where they had decided that they were going to quarantine, or quarantine was going to be used as a form of punishment for breaking the laws. So we've seen civil society organizations appending their signatures to some of these petitions and then sending this repeatedly. And then there's a capacity building process that's going on the platform that has been extremely amazing. So people are actually able to access training that was, before confined to small groups of people, and now it's on social media. So we have more people, and therefore for me, that means that we're building more capacity of not just civil society, but also the public everybody's also always getting the same information, and they're using this information to be able to ask questions, ask the right questions, and then follow up. The other thing also is that, we've been able to use, as Wendy said, the local media, using the local language to be able to break down the laws that the government has passed so that people can understand how they're working, to be able to talk about people's rights, to talk about responsibility of the state, and then just about reporting violations, creating linkages between citizens and independent institutions to support them to be able to ensure that they're able to get justice or to demand for accountability. And then also, we've also seen civil society also strengthening their engagement with the state, especially at the county level. So members of the county assembly, we've seen that going on, and even some members in the executive. So that's really been a plus in terms of how we are transferring the strategies that we've been using and changing it so that we're now starting to see how do we build partnerships to be able to address the challenges.
Mm-hmm. Thank you, Betty. Daniela, what has Colombian civil society been doing, and how has it responded to the situation, and what else can be done?
Yes, well, solidarity in our country is rising more than ever, actually. There has been many initiatives carried out by the civil society to give humanitarian emergency response to poor people, migrants, and ethnic communities. For example, some psychologists have organized to attend people for free. Doctors have set up free online care channels to attend the minor cases of people who cannot pay attention or are at high risk of contagion. And different social organizations are constantly monitoring the measures introduced by the government to warn of possible excess or violation of human rights. Likewise, organizations like Fundación Paz y Reconciliación, for which I work for, are overseeing public procurement to deal with the pandemic. And so far, we have denounced more than 300 contracts with cost overruns and other irregularities. Actually, I think most of civil society organizations are trying to make a counterweight to the government because of the other branches of power are working at his half of capacity, I think. And I think we should be changing the focus of the public debate to the important things, because right now the government has occupied most of the debate on the social media, and there are many things, scandals that are hide because of the pandemic. So I think the most important thing that the civil society organization can done in this pandemic is trying to center the debate, the public debate, on the human rights violations and authoritarianism that is rising in our societies right now. It's really important to work together too for this.
Thank you, Daniela. Tajiel, how has Tanzanian civil society been working in this situation that is not as critical for you guys as you've shared with us today, but how has it been affected, or how have you responded to the issues that have been brought up by the COVID-19?
Well, at the beginning, most of civil society wanted the government to introduce a lockdown as other country did. But with time of voices demanding the lockdown along within the country or some part of the country, everyone saw that the government is at the point of no return. So what can we do as a civil society? So as a response to that, civil society started providing public awareness about the COVID-19 and how can we protect ourselves and a number of issues. Other response included a program on mental health, with this COVID-19, the fear of losing someone you love and economy going down and business collapsing. So there was a lot to do with the public mental health, and civil society championed that in different platforms. But also the civil society community donated facility for wash programs within the city, so people can wash their hands regularly with the soap and flowing water, or using sanitizer and number of things. Again, I can say one of the critical things that civil society really demanded, and up to now there is a demand on that, is the right to information, right to information about the COVID-19. We want to know the magnitude of COVID-19 in Tanzania. So these figures, they are not there, and the civil society is demanding that. But it reaching a point that, okay, it's like everything is okay now. So even if we have data or no data, maybe we probably won't change anything, because at the other end, there is a discussion, a public debate on the role of fear in a COVID-19. So as of now, the fear of virus is very low. So and some guys, they're saying that with increased fear of virus, it also lower your capacity, your ability to fight the virus. So if you are too much in fear, probably it will take you away. But again, if you look at the personally, if you look around the people that I'm living with and the community and friends, they're just going on with their business as usual. Of course, I have lots of friends, but not many as when I see the figures from other countries. I'm even shocked why does it happen here? So it's more of, there is communication earlier that if you have a good immunity, or you can use some home remedies to boost your immunity, for sure you want to get the virus, and if you get it, you go avoid. So that are things to do. I mean, that's a situation. What we can do for now, I think as a civil society, we really need to join hands on fighting misinformation. We have seen during the COVID-19, we had a lot of misinformation about almost every angle of the COVID itself. So joining hands to fight this misinformation, I think it will be very good opportunity for us to be able to lead the people that we serve with the right information. But again, I think as a civil society, we will also need to look at the home-inspired solution, the people that we are serving. When we go to the community and work to them, let's say I'm talking, for instance, about climate resilience or any other subject, mostly these people that you are serving, they have something to contribute in terms of their traditional way of solving such a crisis or such a problem. So if we can blend the understanding and our technical understanding, I think we can come up with something, rather than going as a civil society with our own solution in our laptop, in our mind, in our books and booklets, and just trying to feed them. So I think having the approach of knowing their solution, what do they do about this? If it happened, maybe something similar to this, what they did, trying to understand the local context of things, I think will be also a good in future response to pandemic or any other cases.
Interesting. And probably this is a humble exercise in that sense, to try to have a global overview and understanding of what's going on and how we are all coping with it in diverse ways. Thank you.
Yeah.
Vasco, how has Brazilian civil society, and specifically the networks that ECAM is part of, responding to this situation? And what else can be done?
So, like I said before, I think civil society has been really important. The civil society groups have been really important at various levels. And the first one is to work together with state, municipal governments, and especially communities about directing emergency aid, emergency supplies that are very much necessary in these communities to help people maintain social isolation without having to go out. And also about getting the word out. So as the Ministry of Health started reducing the information it was releasing about what's happening in Brazil, civil society groups and media groups took that position. And today, for example, if you want to know what the situation is with indigenous communities in COVID, for example, the National Indigenous Organization has a website you can go to and you can find the latest information. The same for Quilombola and other groups. But for me, the most important role that civil society groups will have is in helping to deal with the impacts of the pandemic. That as the pandemic moves into more marginalized groups and its impacts go beyond the immediate health impacts, but also the longer term impacts. As we know, a number of COVID patients continue to have impacts on their health as they start recuperating. Communities are losing leaders, elders who are truly important, not just in terms of the knowledge that they have and of their traditions and cultures, but also their leadership. The economic impacts that these communities, and whether they're rural communities or any type of marginalized community or any others have. But as the world will move on and start looking at other things or starts thinking about the economic reconstruction, it's really important for civil society groups to continue to bring to attention those groups that are normally invisible, and how policies and support needs to be directed to these groups to help them in reconstruction. And together with these communities, and as a responsibility of civil society, is to look for better solutions. So this opportunity in terms of reconstruction is how can we reduce inequalities? How can we reduce the stress on our environment? How can we introduce more climate resilience, for example, in all of these reconstructions? So the role of civil society groups will continue to need to be expanded beyond the emergency support that has been given, but to really be able to help or assist communities in giving them voice in the reconstruction.
Mm-hmm. Thank you, Vasco. Abdinur, how has Somalian civil society been responding to the COVID-19 crisis, and what else can be done?
Yeah, basically they were doing a lot of COVID-19 awareness creation through dissemination of information, through radios and social media. Others were distributing COVID-19 kits, hygiene and wash kits. For Raho, in particular, we have distributed hunger relief ration for emergency households. We have also decided to bring together many other youth groups into one forum to advocate for issues like political participation, COVID-19 awareness, peace building, and reconciliation. We believe that COVID-19 is there, very unpredictable. Nobody knows when it will end. But Somali is supposed to have an election in the next 7 months coming. And issues of political participation for marginalized groups like women, youth, and people with disability is very paramount. Somali Constitution Article 22 says that everybody has got the right to be elected or to elect somebody. But as the political climate shows, and with this COVID-19 restriction, it seems many of those issues have been put under the carpet, and the COVID-19 is now becoming everything. So we have decided to go an extra mile and through Zooming, through Skype calls, Skype meeting, to have people to have a civil engagement and civil education for many of those issues. The biggest challenges for those organizations that are distributing some of these kits is because of, one, donor fatigue in Somalia. Secondly, access. Most of these areas majority of Somalis under the control of other groups, which is very inaccessible. The third group is that we know that currently the air transportation is not there, land transportation is not there, and because of the monsoon winds, the vital imports of Somali is being brought by big canoes or big boats, which cannot be used at the moment because of the monsoon winds from the Arabian Peninsula. So that is bringing another logistical constraint on most of the civil society activities in Somalia. Thank you so much.
Thank you, Abdi. I know we're already out of time, but we still want to bring some questions from our viewers that will be addressed specifically to some of our participants. We want to start with a question posted by Salim from Kenya, and it's addressed to Abdi Nur. So Abdi, Salim is asking us, how is the health facility coping in Somalia? If you can briefly share with us about this.
Thank you, Salim. As initially stated, Somali health system is very weak and very fragile, both manpower and resource. Many of the government health services on private hands. The COVID-19 pandemic has given its team a more weaker system. What is there at the moment is that the only health facilities, what we have at the moment is that we have no testing, we have no tracing, no social distancing, not wearing masks. So it is everybody by itself. You take your own health by your own self. And it's a few quarantine areas, and facilities that are COVID-19 are mostly funded by UN organizations and other donor agencies. And it's very minimal compared to the need on ground. As initially stated, we don't have a specific number of the cases in Somalia, both deaths and the exact cases because of, and I said, accessibility, and the government is unable to even get a concrete data on how many people are affected. So we're in a bleak situation. It is, what do I say? We in Somalia, we say it is about we are the lowest of the low. That's what we are in Somalia. Thank you so much.
Thank you, Tajer. We have another question here, which is addressed to Vasco. And we have from Kenya, from Kakamega. Sorry if I mispronounced it. Anne from Kenya. She wants to know why are cases rapidly increasing in Brazil and in South America countries. Vasco, you can answer it, and maybe if Wendy or Daniela also wants to contribute after Vasco, you're welcome.
Definitely, and it's a great question, and I think there are going to be a lot of studies over the next couple of years to try to figure it out. Why did it explode? Because, for example, if you look at Peru, quickly, Peru imposed a number of measures to try to contain it, and yet it still suffered, or is still suffering, an explosion of cases. In the case of Brazil as well, you had initial measures that were imposed. But if you look at if you look at where the cases began, which was in these big mega cities, Rio, São Paulo, where you have people really very close to each other in situations where they can't do social isolations, Manaus, Belém. So in these cases, people were just not able to protect themselves, and yet these cities are tied to the rest of the country through transport networks, roads and rivers and other highways and plains and others. So Brazil, as as we've been saying, is such a huge country with so many different realities, but it has a lot of transport networks that weren't shut down. And so as these large cities felt these cases, and they weren't able to respond quickly enough and to really impose lockdowns. And that's what the discussion has been. If you're a democratic society, can you really impose a lockdown? And how much, how strong can you enforce it? And in a sense that also, if you have the economic inequalities in these regions where great numbers of people are simply not able to self-isolate, and they depend on their daily income and have to go out into society in order to maintain themselves. So all of these factors come together in countries like Brazil. And unfortunately, then with reduced actions by the federal government in terms of lack of guidance, and in essence, a relaxation of the policies that were in place while you were still on the wrong side of the curve as cases were increasing, all of that has come together to create the current situation in Brazil, in my opinion. But it's a great question. And like I said, we're looking forward to understanding that better over the next couple of years. Unfortunately, we don't have much better answer than that right now.
Yeah, I don't know if Wendy or Daniela wants to complement something. Yeah, please, let's start with Wendy.
Yeah, we start early here in Guatemala with the measures to stay at home and the lockdown and the curfew in March, early March. But few Guatemalans were able to stay at home because many work in the informal economy, and they need to go out to survive, yeah, and their families. So, and also many Guatemalans didn't take it serious to stay at home, that can able to stay at home and work from home. So I think this happens too, and all the cases are concentrated in Guatemala City, 70%, and fortunately in rural areas are not many cases, because in urban areas it is not easy to, the social distance too. So I think these are what is happening here in Guatemala.
Thank you, Wendy. Daniela, please.
Yes, I agree with my colleagues. I think the social isolation is like the main reason of why our cases rapidly increasing in South American countries. Like we have two aspects of that problem. On the one hand, we have like the measures taken by the government to keep isolation, but on the other hand, we have like the people cultures or to self-isolate. So Peru is a really good example of that, because Peru and Colombia implement the lockdown at the same time, but cases in Peru were increasing much more rapidly than in Colombia. And it has to be, I think, with the capacity of keeping the lockdown because of the economic facilities, and also the capacity of the government to follow and like trace cases and isolate just that people. And there are many factors that are impacting these capacities. So I think, as Vasco said, in the next years we will have many studies that explain why in some countries, even when they take the lockdown at the same moment, the curves like were so different.
Yeah, definitely. We'll have a whole line of studies about the post-COVID situation and what happened in this really particular and crazy period of time that we're living. We move on to a third and final question, and this one is specifically addressed to Betty. It's from Caro Kaya, and she wants to ask, how do we protect our children, especially those in the grassroots, during this pandemic, especially with rising cases of domestic violence and teenage pregnancies? Please, Betty, maybe you have some insights on this question that Caro is bringing to us.
Okay, so I am going to speak as a Kenyan, but also as an African. We have to revert back to indigenous culture or knowledge. And at that time, it was the role of the grandparents in every single community or in every single homestead. And they had a responsibility, or they felt it was their responsibility, to be able to see how they could nurture girls. And of course, the grandfathers would also be able to do the same to the boys. Those structures have actually collapsed now, And so for us to be able to deal with the imagined pandemic, because that's what it is, where we have recorded such high number of teenage pregnancies, we have to go back into, meaningful education. How do we engage with the children in a language that is not seen as increasing opportunities or is not looked down upon? Because where we've wanted to have sexual education taught, because of what we're seeing now, there has been a hue and uproar about how we wanted to influence our children by exposing them to be able to engage in sexual activity. And yet we are witnessing what's going on. The other thing that we have to do is we must be able to address poverty reduction. A number of these girls that we're talking about, you discover some of them are actually out of school. Some of them are dealing with issues around sexual violence in their past. There's the whole aspect around substance abuse. And then remember that in some of our cultures, we're still dealing with the tradition of early marriages. Those play a key role in the teenage pregnancies that we're now witnessing. And for us to be able to address it requires a holistic approach where we are addressing why the whole issue that enables children to feel that they can engage in a sexual activity to be able to generate money, or where we are giving away our girls to be able to see how in return we can be able to get resources, but also just looking also at just having basic education for the families so that they're able to protect their children and be able to have conversations around, sex and sexuality without necessarily being seen as somebody who is promoting sexual action or sexual activity for the girl or for the boy child as well.
Thank you, Betty. Thank you, Betty. And well, I think our time is up, most than up. We thank our viewers and especially also our guests today for taking the time and the extra time that we've been sharing on this very enriching conversation. We hope all of you have enjoyed this dialogue. And we want our viewers to know also that these are issues that Forum Syd is working on actively, and we will continue to address the situation on human rights and spaces for civil society around the world. On some subsequent sessions, hopefully soon enough, we will have another Glocal Voices from other regions joining us to co-share and co-learn about different perspectives on this issue. So keep your eyes open for that. Wendy, Daniela, Betty, Vasco, Abdinur, and Tajiel, thank you very much for your time and for your valuable insights. It's always time is always against us when we want to try and cope up and bring more and more of these possibilities of comparing, contrasting, sharing. We are connected now, and hopefully our viewers also can reach us and you in any case that they want to ask something or comment, or just bringing these links that we need to bring forward to make up this situation an opportunity for social movements, for civil society in general, to advocate and to act for transformative agendas in the world and in our regions. So thanks for watching. Thanks, everyone. And until next time.
Hey, happy Sunday, everyone. We are so excited to be with you. We want to welcome both our local congregation and our global congregation. We're so excited about what God's about to do today.
We absolutely are. It's so fun to spend the morning with you or wherever you are. We know that we've got a global community with us, and we're just really excited to worship with you. We're anticipating the presence of God to come this morning. And yeah, there's lots to celebrate.
Yeah, and on my way in, I was driving and I heard God say, I want to be known today as the God of extravagance.
Wow.
And so I'm anticipating an extravagant God showing up in such a myriad of different ways. So I just want us to be in a place of expectation. Let's expect that God's going to show up, and maybe he's going to show up in ways we haven't seen before. And so if you're at home, you know, I would say get comfortable, but I would rather you not get comfortable. I'd rather you get ready to worship, stand up on your feet, really engage at home, and we're going to have a good time.
We sure are. Well, thanks so much for being here. We're excited to be with you this morning, and yeah, let's do it.
We'll see you soon.
All right, good morning, Bethel Church. Welcome. We're glad you're here with us, and all those that are watching in their homes in our own city, hello to all your homes. We're so glad you are together this morning, and those of you that are watching from around the world, in whatever space, some of you in your car, whatever it may be, hello. Thankful you're with us. We have a few of our staff and friends here this morning, but we're excited to start the service with you. I want to start with a psalm, and then we'll get right into worship, because that's what we're all deeply desiring for. I may have some funny stories. You can't see my feet, but I'm wearing Crocs because it's cropped from here down, but I'm wearing Crocs this morning. Don't worry, they look cool. Anyway, Psalm 105. Oh, give thanks to the Lord. I was going to say for Crocs, but oh, give thanks to the Lord. Call upon his name. Make his deeds known among the people. I'm reading the wrong psalm. Turn the page. It turned on. The wind blew it. Sorry. Reset. Hi. My name's Chris Cruz. Glad you're in your home. So excited you're with us this morning. I'm hitting home runs right now. This is feeling really, really good. Anyway, it's because of my shoes. That's why the distraction's happening all around the room. All the judgment's happening in the room. But let me read Psalm 103, because this is the real psalm I wanted to read this morning. Bless the Lord, O my soul. That's the right one. And all that is within me. I love this part of this psalm, and this is why. It has two distinctions here. One, bless the Lord, O my soul. And then he changes and doesn't say, O my soul again. He says, and all that is within me. He makes this distinction that there is all these parts of who I am. My mind, my emotions, my will, my relationships, all the things that are in me, everything, my holistic being. Will worship you. Every part of who I am, all of me will worship you. All that is within me. And as our soul goes through us, there's this idea too, like this is the idea of like our whole being and our soul, this whole thing happening, will worship him. And so, Father, we say right now, all of us is present to you. All of us is present to you. With all our mind, and this is what Jesus said, with all our soul, with all our strength, with all our heart. So we bring all of these things, Jesus, all of who we are this morning. No part of us is left out. We're not leaving anything on the side that we're scared to bring before you. You're not this emotionally finicky God who's scared for us to bring ourselves. We come all as we are. No masks. No masks. We know you don't polish masks. You don't heal egos. You heal people. So we come as we are. Have your presence wash over us this morning. As Candace said in our pastor's prayer upstairs, that he would rest on us right now. Like a blanket. I just see like a weighted blanket coming upon the people of God right now. The reality of heaven will become so tangible. all of our senses would become in tune with it. In Jesus' name, amen.
Oh, here I am to worship. Here I am to bow down. Here I am to say that you're my God. You're altogether lovely, altogether worthy, altogether wonderful to me. Can we just sing that again together? Oh, here I am to worship. Here I am, all of me. Oh, here I am to say, you're my God. You're altogether lovely, altogether worthy, altogether wonderful to me. You're altogether. Oh, you're altogether lovely, altogether worthy, altogether wonderful to me. So here we are, oh, there is no shadow that could ever overcome your light, and there is no rival that could ever stand against your might. You've always been with us. Every battle we've already won. Oh, we've already won. There's no weapon. Oh, there is no weapon that has ever left a mark on you. And there is no army with the power to conquer truth. You've always been with us. Every battle you've already won. We've already won. Show me one thing you can't do. Show me a mountain he can't move. He's the God of the breakthrough, and anything is possible. Hey! Show me one thing that's too hard. Show me waters he can't part. He's the God of the breakthrough, and anything is possible. Is possible. There is a kingdom that's advancing at the speed of light, and in his kingdom, every dead thing is bound to rise. Oh God, our Redeemer, he is faithful to revive. Oh, you will revive. Hey! Show me one thing he can't do. Show me a mountain he can't move. He's the God of the breakthrough, and anything is possible. Show me one thing that's too hard. Show me waters he can't part. He's the God of the breakthrough, and anything is possible. It's possible. So all of my fear I will turn into praise. I'll shake off despair as I sing out your name. A victory dance, I will dance out in faith. I will crush disappointment and break every chain. Oh, all of my fear, we're turning into praise. We shake off despair as I sing out your name. A victory dance, we will dance out in faith. I will crush disappointment and break every chain. All of my fear, I will turn into praise. I'll shake off despair as I sing out your name. There's no time for despair today. There's no time for fear. There's only time for